Good afternoon. My name is Wendy Fucile, and I am the President of the Registered Nurses Association of Ontario, and I am here today to talk to you about a critical and urgent matter. Health has been and continues to be a critical issue. It is not an easy issue, but it is one that matters to us, to our parents and grandparents, to our children and to their children. RNAO's prescription for our healthcare system is clear and urgent. The solutions that we see fall into four general baskets, and the first of these is the urgent need to defend our publicly funded, publicly delivered, not-for-profit healthcare system, to enforce the provisions of the Canada Health Act, and to further extend and strengthen that system through the provision of a national pharmacare program. Secondly, we must address in our own country, with our own solutions, the health human resource shortages that have arisen over the last 2 decades due to a variety of ill-advised policy decisions. Within nursing specifically, we need to invest in strengthening the infrastructure of our academic institutions. And we need to substantially increase nationwide the number of nurse educators by supporting graduate education. Across the country, we need to increase the number of seats and expand to the full range of clinical practice opportunities that exist today in our system. Increasingly, more men and women want to become nurses. This year, in fact, across this country, we had more applicants than ever before. Sadly, we do not have the capacity to admit all of the qualified applicants. Thirdly, we must tackle on several fronts the social determinants that so dramatically affect the health of each of us as individuals and of our communities. The eradication of poverty, and most particularly child poverty, the provision of safe, affordable housing, a living wage, a clean environment, and sufficient staff to ensure the safety of our food supply, safety so that we never again face what we have seen with the listeriosis outbreak. These must all be addressed, and addressed now. And lastly, we must secure fair taxation. Nurses say and have said, this is not the time for tax cuts. This is the time to strengthen Medicare, to build pharmacare, to secure an adequate supply of human health resources. This is the time to make poverty history and to bring to our children a clean environment. Is it easy? No. Is it necessary? Critically so. And it is our challenge to every candidate from every party that he or she fully disclose and debate the health care platform of their party so that we as voters may make informed choices. To do otherwise diminishes and undermines the very democracy upon which this country is built. Nurses also urge the public, each and every one, to attend public forums, all candidates' debates, town hall meetings. We ask you to demand answers, the answers you are entitled to become informed and to vote with a full awareness of how your health and the health of your loved ones will be affected by the actions of those who come to office. I thank you for the opportunity to speak to you today.